A new report finds working racialized women are struggling the most to recover from the effects of the pandemic, especially when it comes to their mental health. The research also finds the services simply aren't there.
The women that we're trying to explore couldn't even start to address their mental health needs because their lives were turned upside down by COVID-19, and they were honestly too busy and too stressed to even tend to their mental health needs.
The principal author of the report, done in partnership with York University and Islamic Relief Canada, surveyed over 100 racialized women across the country. Majority are essential workers, but some are high-paid professionals as well.
We had found really high levels of anxiety and exhaustion and burnout before COVID-19. All of the negative outcomes that we included in our survey had increased at the height of the pandemic. And then when some restrictions were lifted, we did see a slight decrease, but the levels were still quite high.
The reasons for mental health stress included the following: an increase in childcare responsibilities, less time for self-care, school and daycare closures, as well as economic hardships. Researcher Grace Barakat says while the pandemic may seem like it's over, the issues are still prevalent.
The cost of living is much higher than it was 2 years ago. We see that with the cost of food increases. We see that with the cost of fuel increase. Affordable housing is still an ongoing problem, despite the federal government releasing a national housing policy. It's a 10-year policy. People don't have 10 years to wait for affordable housing. We still have the issue of affordable daycare.
The study also found the number one reason for not seeking professional help is the stigma of mental health, followed by no time for therapy, the cost, or not having coverage.
Telling people that you're going through this, seeking, counseling, for example, it's not something that the community or a lot of people feel comfortable talking about. Not necessarily just, racialized communities, but also people in, professions. They might feel that if they tell people about this, they may be overlooked, or they think that they're not able to do their jobs.
The report is making a few recommendations to address this concern, including ensuring mental health services are accessible and culturally sensitive to racial minorities. It also suggests services should be offered in several languages and included in OHIP coverage. For City News, I'm Maleeha Sheikh.